One of the nation's largest insurance companies has reversed its decision to deny a Texas woman's mental health needs. The change comes after Kxan investigators started looking into tips that insurers aren't covering mental telehealth services amid stay-at-home orders during the COVID-19 pandemic.
Our investigator Jody Barr discovered many other Texans are still struggling with this problem.
This is how I've been spending my time when I'm not working from home. It kind of is a way to pass the hours and not just spend all my time on Netflix.
Megan Gordon's embroiled in a fight with Blue Cross Blue Shield of Texas, trying to get the insurance giant to cover visits to her therapists.
Depending on how long we're doing work at home, I might actually get good.
Gordon has health insurance through her teaching job. She never had a problem before, but when her therapist was forced into providing sessions over a telehealth portal, Gordon says her insurer put the brakes on coverage.
When I called them, they told me that they would not cover that visit, even though she's a participating provider and they've covered in-person visits before.
The insurance company is telling you, because you can't see your provider in person, we're not paying for it.
Yes, exactly. They're only willing to pay for in-person visits.
She's repeated this same process for the past 3 weeks.
Please tell me the reason for your call.
Coverage.
She even knows the automated menu by heart.
This is my 4th time contacting them about this, so.
She says BCBS told her, although they denied her coverage, her request for telehealth coverage is in review.
Is that still in review, or are they still making a decision on that?
Right.
Okay.
It's still in review.
Okay. Do you know how long it's going to be in review? I've been trying to follow up every week or a couple times a week, and it's.
No, ma'am.
For people on self-funded or employer-funded plans, they don't really have any options. It's what the insurance company decides to cover, and unfortunately they're choosing not to cover these visits.
Providers tell us the problems rest with private employer-funded health plans. Some plans provide telehealth coverage for behavioral health, some don't, even under the same insurer.
You know, you just go on here and just hit click video, just start talking.
Anita Robertson treats depression and anxiety, and like most other therapists in Texas, is only seeing patients over the internet for now.
You can just see that it's just a little telehealth app.
With so much isolation, something that could be a suicide risk factor, she says patients need help now more than ever. The barrier, she says, is insurance denials. Despite the financial gamble, she's still treating those who need her most.
Ethically, as a provider, I feel like it would be unethical to stop treatment just because people can't pay in this time, because it would create way more harm. And yet it's also unsustainable for me long-term to be able to see clients for copays or for nothing.
But how can a Texan not have a painting of a longhorn?
I think that might have to be the next one.
Hours after we asked Gordon's insurer about her case, it reversed its decision, offering full coverage through April. Gordon's worries, though, are for other Texans. A reasonable person would argue that it's better to pay for a telehealth visit than for someone to not be seen at all. Is that fair?
Yes, I would agree.
Experts in the insurance billing field tell us the fix would come at the federal level with a change in law. We spoke with Congressman Lloyd Doggett and Michael McCall's offices. Both tell me they're working to figure out how this disparity exists from plan to plan and how to handle it. Jody Barr, KXAN investigates.
Blue Cross Blue Shield couldn't give us specifics on exactly why some people are covered while others aren't. The insurer did release a statement telling us behavioral health services performed over telehealth portals are covered for private health plans. But if the employer's plan doesn't include telehealth coverage, Blue Cross Blue Shield will not cover visits performed over the internet.